Now, Dr. Abraar Karan joins us now. He's an infectious disease fellow at Stanford University. Thank you very much for your time there. Now, we're into the beginning of the third year of this pandemic, an incredibly devastating one. In the US here, however, infections are down, deaths are up. How would you describe our progress?
So, I think that we realize now over the last couple of years how complicated it is to actually have an epidemic strategy, a coordinated strategy where we utilize testing, tracing, isolating, vaccinations, and play to our advantage the epidemiology such that we have less transmission in certain areas. So if we look at it by breaking it down, in terms of testing, now the Biden administration is sending out more antigen tests, but we need far more in terms of the actual supply, right? So antigen to be useful, really you need to have serial testing that you can utilize to really slow down the epidemic. In terms of our PCR turnaround time, we still are lagging a little bit. If you look at Wuhan early in 2020, they were able to get it down to a few hours. And here we see that our testing infrastructure still gets quite overwhelmed. Some areas doing better than others. Tracing wise, tracing improved, but still was not fast enough to keep up with even pre-Omicron, but definitely not with Omicron. So we felt very behind on tracing, and then isolating just didn't work well in the U.S. at all. So we saw a lot of home-based infections, people going back home, their families get sick a little bit later. We saw this from the very beginning. We saw this kind of ongoing after that. Now, in terms of vaccinations, there's a big patchwork of vaccinations. So if you look at even the 2-dose vaccinations around the country, many states are at about the 50% mark, others are in the 80% mark, and we're much lower than that when it comes to boosting. And so I think that a coordinated strategy is what we were hoping for as infectious disease specialists and epidemiologists. And I think that there's still a long way to go for even the Biden administration.
Has Omicron spread helped to push coronavirus from the pandemic phase to a more manageable endemic phase yet? Are we there? Are we in more of a kind of calmer phase in this pandemic?
Yeah, I mean, so cases are going down, right? Cases will go down. You have a surge, you go up, and then you have a lot of people infected, and you will see some immunity. How long that lasts, how durable it is, we don't know. I mean, with a milder infection like this, that's primarily in the upper respiratory tract, it may not give us long-term durable immunity. And the other part of the equation is variance. So I think in that way, it's hard to predict that. But secondly, endemicity is very complicated, right? Because you have different diseases that are endemic in different places, but the level of endemicity, the number of cases that you expect on average in any given season or any given time, is very different in different parts of the world. And that matters because that can still put strains on your healthcare system. So I think people are misunderstanding when they say endemic to mean that things are going to go back to pre-COVID. I don't think that'll be the case.
And what about in terms of being here in the US? There's a huge fatigue from the pandemic now. At what point do you think it's safe to lift some of more of these social safety measures and people can start to have a bit more of normalcy in their lives?
Well, let me start by saying I'm fatigued too. Everybody's tired, and there are a lot of costs to having some of the mitigation measures in place for people. Certainly, on the one extreme, when you shut things down, the economy suffers, people's mental health suffers. There's a lot of consequences. As a doctor, I saw that too. I saw a lot of patients coming back with new alcoholism, missing medications, the consequences of delaying, surgeries that were deemed elective. I've seen all that as a physician. But I think that if we just open completely, what we're doing is we're letting a lot of people get infected with a virus that, isn't necessarily mild. Even I had gotten Omicron earlier in the surge, and it was not mild for me. I was out for many days. After that, I still had symptoms. Thankfully, they're gone now. But I think that it's, just letting people get infected. We don't know the longer term consequences of this, and countries have shown that you can get infection levels down. I think that's important.